When you think of prevention, what you usually think of is never getting the disease in the first place. But actually, it's a little bit more convoluted than that, and I want to go over some vocabulary and then solidify it so that you know what type of intervention is what type of prevention. You'll see what I mean in a minute. There's 3 degrees of prevention. Primary prevention is what you think of as the lay term of prevention. That is, you prevent the onset of disease. We're going to use an example of hypertension here through this, and then we'll get into more details at the end. The idea here is that a normal patient may progress to having hypertension. Primary prevention would intervene to keep the person normal. That is, they never develop hypertension in the first place. Secondary prevention is all about detection. They have the disease. What you want to do is delay progression. That is, the person who has hypertension will be prevented from developing the sequela of a myocardial infarction. Tertiary prevention is not prevention at all. This is preventing the complications that arise of that sequela. In this case, the myocardial infarction would lead to CHF. Now, it can become a little convoluted about which one is which, but there are some things that come up a lot that are going to then help you label which one it is, and if you just memorize it and try to figure it out, you can get some points on the test. In life, you're just going to do these things. It doesn't matter what you call them, you're going to do them all. But as it comes to the testing, you might find yourself caught trying to pick primary, secondary, and tertiary. Primary prevention is what you want to do. Primary prevention is all about reducing exposure. We know certain exposures cause diseases. We generally call them risk factors. The goal here is to reduce exposure in the first place. Examples of primary prevention are going to be things like weight loss, smoking cessation, reduce alcohol intake, and eating better. Now, eating better is meant to be intentionally vague because this is a touchy subject, but of course, more leafy greens, more vegetables, more organic stuff, better than fast food and processed foods. Primary prevention may also be in the form of a therapy though, right? So primary prevention may include vaccination. The idea is that we either prevent any problem from coming if they get exposed, or we reduce the exposure overall. Secondary prevention is more about screening and early intervention. Screening and intervention is going to be achieved with screening tests. And to be a good screening test, you generally want to be sensitive. That is, we'll tolerate false positives so that we don't miss false negatives. And when we identify disease early, we intervene, generally in the form of lifestyle modifications, of course, but often medications. To use a concrete example, diabetics who are diagnosed with an A1C of 7.1 are put on oral medications and asked to exercise. Their A1C may fall to non-diabetic levels. You get a diabetic diagnosed with an A1C of 14 and you need to put them on multi-daily injections of subcutaneous insulin, they're likely to get worse. So secondary prevention is about finding disease early through screening tests and intervening before they become a problem. Tertiary prevention is about treatment of disease. This is going to be achieved through lifestyle modifications, but usually that is not enough. So tertiary prevention is almost never lifestyle. At this point, it is going to be through treatments and is generally considered more responsive than preventive. And here I'm talking about neoadjuvant chemotherapy for breast cancer, aspirin, statin, beta blocker, ACE inhibitor for coronary artery disease after the stent's been placed with clopidogrel. Tertiary prevention is what you do when you treat disease. Secondary prevention is figuring out that they have it in the first place and trying to get rid of it. Primary prevention is reducing the exposure so they never develop it in the first place. And to get on my soapbox a little bit here, primary prevention costs very little. It's usually just talking to somebody. It doesn't involve anything except maybe a vaccine. Secondary prevention costs a little bit more. That's screening colonoscopy, or the fact that you end up treating someone with stage 1 hypertension. But the big deal is tertiary prevention, active therapy, is the most costly. Chemotherapy for drugs, frequent bouts to the hospital. The idea being that those who are in tertiary prevention are the ones who are going to cost the most. And the reason in our country that 99% of our healthcare dollars goes towards 1% of the population is because that 1% is here. They have severe disease, they're barely hanging on, and we're giving all the therapy we can to keep them alive. Whereas those people who were healthy and stay healthy don't cost anything. That's prevention.